I'm Nick Zanetti. I work with Pillars of Good Health in association with the Collegiate Care program. So what's the Collegiate Care program? So Boston is obviously a city where there are a lot of colleges, and what we find, unfortunately, is that is a time, that is an age where young people often have first psychotic breaks. That is, their first encounters with major mental illness. And a lot of times it's pretty dramatic for families because the families aren't there and the students are on their own in a new city and facing not just college but a whole world of mental illness. And so what Pillars of Good Health tries to do is to help those students in those critical moments of getting used to what it's like to live with mental illness in a context of school. So let's distinguish that from things like tutoring, right? Pillars can also put students in touch with tutors for their clients, but really what we do is we help integrate the student back into their life after they've suffered this first psychotic break, instances of severe depression, crippling anxiety, mood disorders that may appear, and help them find their way back into their college life in such a way that is really successful and going to give them the best outcomes. This is really good because it helps the student orient to their new conditions of their new illness and help them build new skills around what they're going to do in terms of organization, sleep hygiene, how they're going to relate to people socially, what are they going to do academically, in such a way that they can really get the care that they need and have the best outcomes. That's kind of what the program is about. We get clients from mental health facilities at universities. We get them from their therapists. We sometimes get calls directly from families. And so the pool of people that are coming to us are from pretty diverse sources. It doesn't really change anything for us, but it is nice when the clients have a therapist on board in the community. We often try to provide that if possible, so that there's a nice play between what the therapist is working on with the client and then what we're helping the client implement in their college experience. Because at the end of the day, it's really not therapy that we're doing, it's really a coaching model. So all the clinicians are all the people who work at Pillars are clinicians. But that said, what we're really doing was we're in the community with the client, whether it's in their dorm room or even going to class with them or waiting by class, helping them organize through a coaching model. It's not exactly therapy, although it can be. Anyway, if you have any more questions, feel free to call or check out the website.